Many of you may be aware that there has been a senior-friendly project in progress for the past 12 months in 4 medical units at QEH, PCH, KCMH and Western Hospital. The purpose of this project was to help maintain a senior patient's pre-admission level of mobility and functionality. To do this, the patient was ambulated with staff up to 3 times a day and they were sat out of bed for all meals. We are now proceeding with implementing this in all acute care facilities in all units with seniors across the province. Any patients 65 years and older, inclusive of inpatients and ALCs, are part of this project. This slide assists with conceptualizing functional decline. A functioning senior becomes acutely ill and they're admitted to hospital. Hospitalization poses a risk for altered functional status for seniors due to acute illness. Decreased mobility, the negative effects of bed rest such as pressure ulcers, pain, dehydration, malnutrition, medication side effects and associated hospital treatment measures such as invasive lines and catheters that limit mobility are all contributing factors to functional decline. Decline in function is often difficult to reverse and may lead to long-term loss of independence, social isolation and reduced quality of life. Inactivity and prolonged bed rest are unnatural states for the human body. Periods of immobility are detrimental to health and adversely affect all major organs. This slide highlights some of the problems associated with bed rest and inactivity. There are many more. Therefore, even if the patient is unable to walk or mobilize well, it is important that they are sat out of bed for meals and mobilized to their level of ability. What does the research say about functional decline? It tells us 30 to 60% of older people experience functional decline when hospitalized. A decline in mobility can start within 2 days of hospitalization. Without mobilization, elderly patients lose 1 to 5% of muscle strength each day. 1 year after hospital discharge, less than 50% of seniors or older adults recover to their pre-illness level of functioning, and rates of long-term care placement are high. What are the foreseeable outcomes when functional decline is appropriately addressed for the patient? It improves their mobility and independence in ADLs. It improves their self-esteem related to greater independence. It also reduces complications during hospitalization and improves the rate of return to pre-hospital living environment. And what are the outcomes for staff when functional decline is appropriately addressed? It improves staff's ability to detect and prevent functional decline. It improves interprofessional collaboration. It empowers staff and improves their satisfaction when caring for older adults. Finally, what are the foreseeable outcomes when functional decline is appropriately addressed for the healthcare system? It results in decreased institutionalization, decreased length of stay and ALC rates, decreased cost to healthcare, and improved patient and family satisfaction. So what is it we are asking staff to do? We are asking you to walk, mobilize patients 65 years and older up to 3 times a day and sit them out of their bed for meals. Mobilizing the patient can mean walking them in the room, in the hallway. However, it can also be as simple as having them stand up and sit down a few times while sitting in their chair, if that is where their ability is at that time. Whatever ability the senior has, we're trying to maintain. You're probably thinking we do this anyway. Yes, we do. But do we consistently do it? Do we automatically think this person would benefit from mobilizing and incorporate it into their plan of care? When we are busy, we may miss mobilizing as frequently as we need to, and this leads to problems as mentioned in the earlier slides. Urinal and bedpan use is strongly discouraged during the day, unless it's medically indicated. Using them may be convenient, may be fast, but they do nothing to help maintain a person's mobility level. They actually encourage immobilization. We are also asking you to sit patients, seniors, out of their beds for their meals, breakfast, dinner and supper. Getting patients out of bed helps prevent the issues mentioned in the earlier slides. We are now going to look at documentation. On your ADL form in CIS, under the Activities section, there is a section to complete. How many times you walked the patient this shift. check off by 1, 2, 3. Walking and mobilizing patients is an excellent task to delegate it to your PCWs. We are providing you with tools to help communicate the importance of mobilizing to your senior patients and their families. This pamphlet explains what we're doing and why we're doing it. We have also developed a patient family information booklet that can be reviewed while in hospital or when they return home. It provides the patient and family with helpful tips and information about maintaining their everyday health while they're admitted to hospital or when they are discharged home. Finally, you may see this poster displayed in your rooms on your units. It is a reminder to staff. Patients may also ask to be taken for a walk. Families may be encouraged to walk with their loved ones when visiting, providing, of course, it's safe to do so. All these materials are available on your units. The next 4 slides are some tips and tricks that the 4 units already live with this project have suggested we share with everyone. Please review. This is the membership of the Senior Friendly Hospital Working Group. Thank you for reviewing.